Okay, let's get right into it. If you or maybe your child feels like you're in a constant battle with ear infections, I'm talking round after round of antibiotics, maybe even ear tube surgeries, you know just how frustrating that is. But what if the real reason they keep coming back has been totally overlooked? Today, we're going to break down the powerful and often missed link between allergies and those chronic ear infections. Does this sound familiar? The pain, the constant doctor's visits, you get some relief for a little while, and then boom, it all starts over again a few months later. You are definitely not alone in this. It's a really common cycle, and figuring out why it happens is the first step to finally breaking it for good.
Yeah, so many people will recognize this exact pattern. It starts with that telltale ear pain, right? Everything sounds kind of muffled. Then come the antibiotics. And for a lot of people, especially kids, it escalates to needing ear tubes sometimes more than once. This whole thing, which doctors call otitis media with effusion, it really feels like a revolving door of symptoms and treatments that just never ends.
So we keep treating the infection, but what if the infection isn't the real problem? What if it's actually just a symptom of something else entirely? What if we're only fighting the very last step in a much longer chain reaction?
Yep, that's right. Allergies. The sneezing, the itchy eyes, the stuffy nose you always connect with something like hay fever, well, that could be the secret driver behind those relentless ear infections. And look, this isn't just some wild guess. It's a connection that's backed by some pretty serious medical research.
And this is not some fringe theory either. As medical experts state really clearly, the relationship between allergies and ear problems is well established. So the key takeaway here is, to solve the ear problem, you might have to start by looking at the nose.
Okay, so how does this actually happen? How does an allergic reaction to something like pollen or dust actually end up causing a painful ear infection? Let's trace the path.
So to really get this, we have to talk about one crucial piece of anatomy, the Eustachian tube. Just think of it as your ear's drainage pipe and pressure release valve, all in one. When it's working the way it's supposed to, it keeps your middle ear clean and balanced. But when it's not, that's when the trouble starts. So here's the chain reaction, step by step. First, an allergen gets into your system. Your body freaks out and releases histamines, which cause inflammation. That inflammation makes the lining of your eustachian tube swell up, basically blocking it shut. Now, fluid can't drain from your middle ear, and that trapped, stagnant fluid becomes the perfect swimming pool for bacteria to grow in. And just like that, you've got a full-blown ear infection. This also explains why kids get slammed with this problem so much more often. A child's eustachian tubes are actually shorter and they lie flatter than an adult's. So just based on their anatomy, their little tubes get blocked way more easily, turning a simple case of the sniffles into a recurring ear nightmare. But, how strong is this connection, really? Well, let's take a look at a groundbreaking study from 2008 that gives us some numbers that are honestly pretty jaw-dropping.
Okay, so these researchers, they decided to focus on the absolute toughest cases. They found 89 patients, a mix of kids and adults, for whom nothing else had worked. They had what's called intractable ear disease, which basically means it was super resistant to all the standard treatments like antibiotics and even repeated tube surgeries. So they tested all 89 of these patients for allergies. And the result, get this, every single one of them, 100%, was found to be allergic. In this group of the absolute most difficult cases, the one common thread wasn't some stubborn superbacteria, it was an underlying allergy.
So naturally, the researchers started treating their allergies. And the result of that? A staggering 85% of these intractable cases, their ear disease completely resolved. Gone. No more fluid, no more drainage, no more infections. The problem just went away.
And just to hammer the point home, they also tracked a control group of patients who had the same issues and the same allergies but refused treatment. You want to guess how many of them got better on their own? 0. A big, fat 0. This clearly wasn't a condition that was just going to fix itself over time. So this is huge, right? If allergies are the cause, then treating the allergies is the solution. And that study pointed to one treatment in particular that made all the difference. It's called allergy immunotherapy. Now, this has actually been around for over 100 years, and it's not about just popping pills to manage symptoms. It's about retraining your immune system to stop overreacting to allergens in the first place. The most common way to do it is with allergy shots.
By introducing these tiny, gradually increasing amounts of an allergen into your system, the treatment basically teaches your body to build up a tolerance. So instead of fighting the allergen and causing all that inflammation, your body just learns to ignore it. It learns to chill out.
And here's the real game changer. Unlike daily allergy pills that just wear off, immunotherapy can lead to lasting relief from symptoms for years, even after you stop the treatment. It's actually addressing the root cause, offering a real long-term solution, not just another temporary fix.
So what does all this mean for how we should think about chronic ear infections? Well, it means we need a major shift in how we look at the whole problem.
You see, the old view sees this as just an infection, something you fight with antibiotics and you drain with surgery. But this new understanding completely reframes it. For so many people, the ear infection isn't the disease itself. It's just a symptom of an underlying allergic condition that can and should be treated at its source.
I mean, the conclusion of that 2008 study really says it all. For patients with these stubborn, intractable middle ear problems, getting a serious allergy evaluation isn't just a nice idea. It's an absolute necessity, because the vast majority of them get better with immunotherapy. So we'll leave you with this question. If you've been stuck on that frustrating treadmill of recurring ear infections, could this be the missing piece of the puzzle for you? It might just be time to stop treating the earache and start investigating the sneeze.